turned to me and said, "How do you do couples therapy anyway?" You know, kind of a weird question. It's like, on the way out, you want me to sum that up, But I had actually given it some thought previously, and I said, I've wondered that myself. Because, you get all the training you get, but what are you really doing? If you boil it down, if I really boil it down, I suppose what I'm essentially conveying to people is be kind and don't panic. That's only 5 words, notice. Be kind
Right.
and and he said, "Oh, that's interesting." And I started sort of saying that to some folks. I'm saying, if you boil down all this stuff, basically what we're doing here is trying to get that sense of be kind and don't panic. And people say, "Oh, that's interesting," because that fits together. You can't be kind, and when I say be kind, I don't just mean be nice. I mean be kin. The word kinship is that's where the word kind comes from. Be kin, in other words, recognize your kinship with this person, even if you're having a hard time. You are kin, you're on the same team, you're in the same tribe, however you want to say it. And it's hard to do that when you're in a panic. In fact, it's pretty much impossible to do that when you're in a panic. So people were saying, "Ah, I get that idea. Yeah, don't panic so you can be kind." Hey, how do you not panic? Darn, you know, because that's kind of the big question, isn't it? So I gave that some thought over a period of time, and I added 2 words to the formula: be kind, don't panic, and have faith. And I got to recognize just saying have faith doesn't tell you much, you know? Really, that's not so much an instruction as an observation. What I noticed was if I thought about the couples I work with, and they're coming, usually people are not seeing a couples therapist lightly,
Sure.
something's wrong, they're in pain. We'll talk, I'm sure we'll talk in a little while about the guy's view of this,
Mhm.
because stereotypically it's the woman who wants to. Of course, there are exceptions to that, but overwhelmingly it's women who are, if a guy's making the appointment, it's almost always because the woman is saying, you better make the appointment. If a woman's making the appointment, it's almost always because she's thinking, I want to make an appointment.
Yeah.
I know there are exceptions, but that's the trend. So, why are people doing this? Well, what I noted was among the people who I've worked with, where it works. Now, what do I mean by works? When I say couples therapy works, I don't mean they necessarily stay together. I don't measure success by whether they stay together or not. But the ones who do stay together, and I'm working, lots of folks are dealing with really heavy stuff like infidelity, for example, all sorts of all kinds of issues. If you can imagine it, I've probably dealt with it. And the couples that manage to get through that and end up feeling like, wow, we're grateful. Speaking of gratitude, which I know is you start your podcast with, the couples that end up grateful for the process are the ones that I would say, what seems to me what they are manifesting is faith. Now, what do I mean by faith? I don't necessarily mean religious faith, although certainly religious faith is often helpful. But I've known very religious people who don't seem to be manifesting faith as I describe it. And I've known very secular people who do manifest it. So, what do I mean by faith? I mean that basic sense, it's a mindset, that basic sense that reality is right to be what it is, even when it sucks, even when it's painful, even when we can't understand it, even when you're dealing with someone and you can't understand how they could have been this way when you thought you knew who they were. There's something right about it.